Welcome to Focus Washington. I'm Stan Collender. I'm here with Ross Brickley, who's got an important story to tell, and one he's going to tell to the Senate Special Aging Committee later today. This is an extraordinary story, and one that might surprise you. But Ross, the basic bottom line question is it true that the Drug Enforcement Administration has actually adopted procedures and rules that's making it difficult for patients in nursing homes to get the pain medication they need?
Yes, Stan, the DEA agents are causing us now delays in our ability to legally dispense medications and get them delivered in a timely manner to the nursing facilities to take care of those patients, those seniors, those frail elderly people who are in pain.
Well, how can that be? Why in the world would DEA be trying to deny medication to people, pain medication, to people who are in a stage in life where it's extremely important?
That's a good question, Stan, and we've been working with them for many years, and the Controlled Substance Act, which is the federal legislation that we have to follow as pharmacists, was written in 1970. And unfortunately, over the years, our patients have become sicker, have become more acute, discharges out of the hospital. And now, after several years of dialogue, the DEA has suddenly begun to enforce a decades-old piece of legislation. And our pharmacists and other physician practitioners are used to practicing in a different manner, where we could get the medications there very timely.
Well, I mean, you've just said something extreme. Actually, you said several things that are extremely interesting, but this is based on a law, a rule, a regulation that's 40 years old?
Yeah, 40 years old. It was written back when, years ago, nursing homes were mom and pop facilities ran by local individuals, and the illness, or the acuity as we call it, of the patients was much lower. Now we have people that are post-hip fracture, people that are dying, hospice patients, in stage, very sick, that need all kinds of high level and often high doses of pain medications to control their situation.
All right, now you're going to be testifying today on behalf of something called the Quality Care Coalition for Patients in Pain. Tell us a second, what is that?
Yeah, that's a coalition of many clinicians, stakeholders in the healthcare system, both physicians, pharmacists, nurses, nursing home associations, national pharmacy associations, all working together with the ultimate goal of making sure that we have the ability to get medications to our patients in these long-term care facilities.
All right, so this is not a question of drug overlords or people selling drugs on the street. These are our nursing home practitioners who are trying to get the medication to patients who absolutely need them, who doctors want them to have it, right?
That's correct, Stan. These are patients that are often in a hospital-type bed in a nursing home, unable to get up and even go out and take a prescription to get it filled at a drugstore. It's such a different patient population. It's a population that oftentimes need medications delivered within 30 minutes to an hour and need them promptly.
Now, all right, you're going to, as part of the hearing today, as part of your testimony, you're going to talk about a survey that the coalition undertook. Very, very briefly, I mean, as I looked at the survey, it shows that there are some extraordinary delays in getting the medication to patients.
Yes, over 900 people responded to the survey, and 40 to 80% of those who responded indicated significant delays in ability to legally, under these new guidance that we're getting, the new interpretations that we're under with the DEA, significant delays in our ability to get medications delivered.
What do you mean by significant? Are we talking hours here?
Yeah, we're talking hours, in some cases 2 or 3 days.
Oh my goodness, days?
Yes.
Well, anybody who's had any family member, any relative, any friend in a nursing home knows that that's just an unacceptable situation. And you've told me that you've tried to talk to the DEA about this. No response?
Yes, we've met with them several times, and they seem to show a concern, Stan, but they don't really give us any advice on how to take it. They say they'll consider it in some situations, and over really decades of time, we've really had no action as far as anything that would allow us to be able to change the law so that we can practice in the kind of practice setting that we're used to practicing in.
All right, so what are you going to tell Congress today? Can DEA fix this themselves, or do we need congressional action?
The good news is, yes, the DEA, we believe, has ability to recognize the nurse as an agent, and therefore this is the nurse in the nursing home as an agent of the doctor, and therefore one of the biggest hurdles we're now facing with the DEA is that they don't recognize the nurse as an agent, that the nurse can't legally send the pharmacy an order or take an order from the physician and send it to the pharmacy. So if the DEA would do that one simple interpretation change, we could legally dispense most medications.
All right, and if they refuse, you're testifying to Congress, or are you going to ask Congress to do something if the DEA won't?
Yes, that's going to be one of our recommendations, that if the DEA will not do anything to help change its interpretation, that we're going to have to go to Congress.
Well, Ross, first of all, good luck. Thank you for being with us today. And for everybody who's had a family member, a friend, whatever, a relative, in a nursing home needing this kind of help, thank you for what you're doing.
Thank you, Stan.
That's it from Focus Washington today. We'll be back again with more on this issue soon.